الرحيم. الأستاذ المساعد الدكتور أحمد صلاح حميد من كلية طب الاسنان قسم جراحة الفم والوجه والفكين. Our lecture today is end-stage renal disease. First of all, I would like to give some idea about the anatomy and the structure of the kidney. Kidney, usually the basic unit, we have two kidneys, left and right. So the basic unit of the kidney is the nephron. And in the nephron, actually, there is a tuft of capillaries or blood vessel. This is called glomerulus, which is situated within a cup-shaped structure. This is called Bowman capsules. There is also tubes. There are what we call proximal convoluted tubules, and also there is a U-shaped tube called loop of Henels, and also there is distal convoluted tubules. So most of the blood filtration occurs in this structure. There are about 2 million of nephrons within each kidney. Sometimes, or what are the functions actually of the kidney? The kidney has two functions, either metabolic function or endocrine function. The metabolic functions includes blood filtration, which is the main function. This is to remove waste product and also the metabolic byproducts actually from the blood, and also to regulate acid base of the plasma, and to also regulate or to control the balance of the fluid electrolytes. So this is the metabolic function of the metabolic functions of the kidney. Also the kidney has endocrine function, in which there is secretion of the erythropoietin hormones. And this erythropoietin stimulates the bone marrow to produce red blood cells. So this is very important. In addition to that, also kidney secretes renin, and this is very important in the regulation of the blood pressure. Also, kidney may participate in the synthesis of vitamin D by secretion of 125 calciferol, and also could be affected by the hormone aldosterone as well as the parathyroid. So the kidney may be affected by certain disease, and these diseases such as hypertension, increase in the blood pressure, as well as diabetes mellitus, sometimes also what we call systemic lupus erythematosus. Both these diseases, or all these diseases actually, in particular hypertension and diabetes mellitus, may affect the kidney, and this will lead to destruction of the nephrons, which is the basic unit of the kidney. In case of destruction of less than 50% of the nephrons within the kidney, in this case it will lead to a condition which is called renal insufficiency. In this condition, actually, there is no clinical manifestation, and the patient usually appears normal. There is no clinical manifestation, but certain laboratory investigation may indicate there is some destruction in the few or certain numbers of nephrons. In this condition, there is destruction in the nephrons, less than 50%, but at the same time, there is compensation, or what we call hypertrophy of the other nephrons, in order to compensate the destructed nephrons. But if there are more than 50% or more than 75% of the nephron destructed, in this case it will lead to a condition called Uremic Syndrome. In the Uremic Syndrome, there is an increase in the blood urea nitrogen, non-proteinous nitrogen waste product. In this case, there is clinical manifestation, and also it could lead to what we call renal failure or chronic renal failure. The clinical manifestation of the chronic renal failure affecting many systems in the body, such as the cardiovascular, pulmonary, GIT, hematological, etc. So for example, in case of the cardiovascular, there is an increase in the blood pressure due to fluid overload. There is also pitting edema, peritoneal or periorbital edema also could be seen. In case of pulmonary, there is shortness of breathing and depressed cough. In case of GIT, there is anorexia, nausea, and vomiting. In the skin or hematologically, the patient usually presents with anemia because there is decrease in the secretion of erythropoietin, so there is decrease in the production and synthesis of the RBC, and this lead to the development of the condition of anemia. Bleeding tendencies due to anemia, there is decrease in the number of the platelets, and this will lead to bleeding tendencies. In the skin, we can also see pruritus, ecchymosis, purple, and so on. And in the musculoskeletal could be cramps, renal osteodystrophy, and bone pain. Actually, renal osteodystrophy, that means there is some destruction in the bone or bone changes actually, and this could be seen in the jaws, in the maxilla, as well as in the mandible. For the laboratory investigation, in order to diagnose the patient, there are many laboratory investigations. This includes urinalysis, general urine examination, glomerular filtration rate. Actually, this depends on the serum creatinine. Creatinine is the byproduct of the muscle activities. So increased creatinine in the blood, this will lead to a toxic condition. And also by investigation, which is for blood urea nitrogen. So this is the most important laboratory investigation, and actually the most important thing is the serum creatinine, because the glomerular filtration rate depends on the serum creatinine in order to diagnose patient with end-stage renal disease. So what is the medical treatment of the patient with end-stage renal disease? Actually, there are two types of treatment, depends on the clinical condition and the clinical manifestation of the patient. Either conservative treatment, in which there's medications prescribed for the patient, or could be dialysis, in which there are two types. Hemodialysis, that means the patients, as we can see here, plugged to a machine, and the blood of the patient filtered through the machine, then returns back to the patient. This is by creation of what we call fistula here, arteriovenous fistula, in order to move the blood to the machine and to filter and then to return back to the patient. The other type of dialysis called peritoneal dialysis. Here, peritoneal cavities, the diacylates injected in the peritoneal cavity, then withdrawn, and this is in order to remove the waste products from the blood and to clean the body from the detrimental waste product or byproducts of the metabolism. So the most important things as a dentist is how we can manage patient with end-stage renal disease. Actually, this disease is important to be known for the dentist, since the patient with this disease might complain of bleeding tendencies, as we mentioned before, and also hypertensive, or the patient may complain of hypertension, and also due to changes in the function of the leukocyte, the patient may be more susceptible to infection and delay in the wound healing. Sometimes also due to complication of end-stage renal disease, such as renal osteodystrophy, the patient might have some changes within bone, increased in the bone trabeculae or decreased in the bone trabeculae, malocclusion, delayed in the eruption of the tooth, and so on. Actually, this could be affected the jaw bones in case of end-stage renal disease. So, first of all, how we can manage patient who is under conservative care. First of all, consult with physician. As we mentioned before, the patient with end-stage renal disease might be affected by certain disease, such as diabetes mellitus or hypertension. So in this case, we have to consult the physician in order to check the condition of these diseases. I mean, diabetes mellitus, the blood pressure, blood glucose level, and also hypertension, the blood pressure, in order to check whether the patient is controlled or not. And also in order to discuss with the physician the treatment plan, I mean the dental treatment plan, whether the patient needs, for example, tooth extraction or periodontal surgery and so on. Because as I mentioned before, the patients may complain of bleeding tendencies, anemia, increase in the hypertension, and so on. If the patient control, so in this case we can give the patient dental treatment as outpatient basis, that means in the dental clinic. Since the causes of end-stage renal disease, I mean diabetes mellitus or hypertension is controlled, so in this case we can give the patient dental treatment or dental management as outpatient basis. But if it is not controlled, in this case we have to avoid dental treatment. But for example, if the patient complaint of severe pain, toothache, or also there is swelling, so in this case, and he is not controlled, so in this case we can manage the patient in the hospital. So in this case it's called inpatient. Also, patient who needs tooth extraction or periodontal surgery, we have to check the screening for bleeding time and platelet count. This is because the patient, as I mentioned before, complaining of decrease in the platelets number or some disturbances in the quality and function of the platelets, so the patient might more susceptible to bleeding or has bleeding tendencies. So in this case, we have to check bleeding time and the platelet count. Hematocrit and hemoglobin, because as I mentioned before, the patient looks anemic. So in this case, hematocrit and also hemoglobin may give an insight about the level of hemoglobin and the number of RBC. Blood pressure should be monitored because usually actually blood pressure could be the cause of end-stage renal disease, or blood pressure could be resulted from the disease process, I mean from the renal end-stage renal disease, because there is secretion of renin and the stimulation of the renin angiotensin system, so this will lead to an increase in the blood pressure and also due to fluid overload. So all of these might lead to actually an increase in the blood pressure. So in this case we have to monitor the blood pressure during dental procedure. Good surgical technique, actually this is in order to avoid any soft tissue trauma or any soft tissue injury, and this may lead also to further bleeding or confused bleeding. Avoid nephrotoxic drugs. Here actually the kidney actually already affected by the disease process. So in this case we have to avoid prescribing drugs such as tetracycline and also acyclovir, which is one of the antiviral drugs. Aminoglycoside should be avoided. Non-steroidal anti-inflammatory drugs such as aspirin, because this is basically it is acetyl salicylic acid, so this may increase the acidity of the plasma and damaging. It has damage effect on the kidney. And also ibuprofen, mefenamic acid. Actually, we have to avoid central nervous system depression drugs such as the narcotics and barbiturates, because this is depressing the nervous system, and basically the patient may complain of SOB, shortness of breathing. So in this case, this may exaggerate or complicate the condition. So in this case, we have to avoid barbiturates and narcotics, which are central nervous system depression. Also, general anesthesia should be avoided, and it is more preferable to deal with the patient using local anesthesia, because already patient is anemic, so in this case decrease in the RBC and hemoglobin, so general anesthesia should be avoided. Valium and benzodiazepam, actually it can be used as safe. The best painkiller for those patients who are suffering from end-stage renal disease is acetaminophen or paracetamol, because this is actually acetaminophen also, it is in high doses might be nephrotoxic, but it can be used for in low doses actually, so in this case it is safe for patient with ESRD. So, for example, if we want to give the patient antibiotics, so in this case, we have to adjust the drugs metabolized by kidneys. For example, if we want to give the patient amoxicillin, so in this case, either to decrease the dose of the drug or to increase the intervals given by the intervals given of the drug. That means instead of, for example, 8 hours, sometimes for amoxicillin, we can give after 10 or 12 hours. So this is in order to decrease the harmful effect of the metabolism or the bioavailability or the metabolism of the drug, the excretion in the kidneys, so in order to decrease the harmful effect of the drug on the kidneys. Managed orofacial infection aggressively. Actually, infection increased acidity of the blood, so in this case we have to deal with this condition, I mean any orofacial infection, aggressively by giving antibiotic. But actually, as I mentioned previously, that adjustment of the drug should be done after consultation with the physician, because as I mentioned, this might be or might cause harmful effect on the kidney. Severe infection, in this case, it is more preferable to consider hospitalization in order to be treated adequately and promptly in order to prevent any complication. So this is the end of the lecture, and thank you for your attention.